Welcome to The Healthline, issues that shape our well-being. I'm your host, Dr. Andrea Ault-Brutus. In The Healthline, we provide engaging and informative content on the factors that shape our health and well-being, along with innovative insights that help us gain a better understanding of our ever-evolving, complex healthcare system. I am excited to welcome back our Dean of the School of Health Sciences, Dean Reginald Alston, who is the mastermind behind our podcast. It's been about 8 months since we launched this podcast.
Time flies.
So welcome back to The Healthline.
Of course, thanks for having me.
Really happy to have you here to talk about the last 8 months and how things have evolved. Looking back on these past months, what has surprised you or impressed you most about the podcast impact so far?
I would say how it has resonated with diverse audiences, students, faculty, stakeholders, local health system leaders. It's given us, being the School of Health Sciences, an opportunity to have open discussions around pertinent topics that we otherwise would not have had this modality to do it. You've been able to invite in a host of different people, giving them opportunity to share their perspectives, you to question them about healthcare delivery and access and equity. That has been, for me, one of the amazing things about the podcast. So many people have had the opportunity to just share their opinion and to hear the opinion of others.
So the feedback you receive from students, faculty, the community, or even the colleagues, like what have people been telling you about the podcast?
Oh, the feedback has been overwhelmingly positive.
Oh, good.
And that's not an exaggeration. Students tell me that it makes real a lot of what they read in the textbooks or hear in their lectures. One very pleasing comment that I've heard from several of my colleagues at other institutions is that they really admire the way in which the podcast has blended the academic voice with that of the voices of the healthcare community, that being the voices of providers and executives and at times patients as well. So people really like that about the podcast. You know, it's often spoke of wanting a forum whereby the scholars and professors can interact with others within the healthcare arena. As I said, providers and executives and so forth. This has really come to fruition with the podcast. It's one thing inviting someone to a class, one class, as a guest lecturer. Here, we have a guest that can speak to many at once. That's sort of the feedback that I've gotten. I think it's been overwhelmingly positive.
That's great. That's great. It's great to hear. So thank you for sharing that. I think about all the past episodes we had, and one of the standouts for me in terms of bringing someone to talk about what they do was our New York State Senator Siela Bynoe. We had her not only at the podcast, but she also met with some of our students afterwards as well. What were your thoughts about that one?
Yeah, I think it was powerful in the sense that she's someone who grew up on Long Island, a local. She understands firsthand what we mean when we talk about barriers to fair, quality health care. She's from a community she shares openly. That was primarily minority, not necessarily affluent. And so to hear her bring that life experience to the podcast, as well as that she's ascended to a level of influence and success that few of us will ever reach.
Yeah.
And so it's comforting to know that she has that very, here again, real sort of understanding. And she's in positions where she can make a difference. She's really at the table.
Yeah. And what was lovely about it was that she had time afterwards to meet with our students. Any thoughts about that time we had together with her?
I'm a big proponent of experts, and I would consider her an expert. Senator, but an expert. Sit with our students and share insights that you and I as faculty may not always be able to provide. And so the students, they were in awe of her because she's a very dynamic person. I think that's who she is. Mm-hmm. But to have the students there digesting all that she was saying, let's not make this a one-time conversation. Mm-hmm. Here's my card. Here's how you can reach me.
Yeah.
And I know that a couple of the students have reached out to her, and she has responded. Mm-hmm. It's gratifying to bring someone in like her and to interact with our students.
We had another major highlight that I'd like to bring up with you is National Public Health Week. So we recently celebrated National Public Health Week in April. What did that mean for the School of Health Sciences this year in particular?
I love National Public Health Week and how Hofstra celebrates it. Mm-hmm. As you know, I'm still relatively new, almost 2 years. In August, I would have been at Hofstra. And at my previous universities, we didn't have the range of events that Hofstra and the School of Health Sciences offers. I love to see how our school provides attendees with expert panels, here again, as I mentioned earlier, with immersion activities of various types, to have thought leaders as keynote speakers. We have politicians, elected officials here, executives, health system executives, to be able to offer that on Long Island and to have so many people attend. One event we had nearly 500 people in attendance. It does what we have as a mission in the School of Health Sciences, and that is to make sure that we are viewed as one of the thought leaders in terms of institutions and in terms of our faculty administrators, and also to show that we are promoters of equity, of access, of quality care, and that we want to provide a place where debate can occur about these various topics to try and reach solutions. It was, in my opinion, a resounding success.
And you mentioned the mission of the School of Health Science. Your vision for the School of Health Sciences. Has that vision evolved over the last year?
I think there's more urgency on my part. The last few months have shown us how the landscape can shift in a very seismic way. I think it's motivated me to make sure that our school, our curriculum, is staying true to our principles of equity, access, the things that I've said numerous times because they're important, and that we make sure that our students understand that these are things that one has to hold true to because changes occur. The one thing we don't want to do, we being the faculty, the students, our partners, is to somehow allow disparities to widen. It's that sense of urgency that I feel, given, as I said, the surprising and shocking and at times disappointing shifts that have happened as it relates to healthcare in the country.
So it sounds like what you're saying is that our mission hasn't changed, and if anything, we need to be more resilient.
Without question. Hold true to what we see as our primary principles.
And as we hold on to those primary core principles, as we evolve, are there any new programs or priorities or partnerships that you are especially excited to talk about?
We as the School of Health Sciences should always be forward-looking, not be comfortable in our success. We should want to grow, expand. We are in the process of developing a PhD, a doctoral degree in health sciences. That's something that's missing from the school. We don't have a PhD currently. We have professional doctorates, one in audiology and one in physical therapy, and we're very proud of those. But a PhD is more of a research degree. That's a group of students that I think it is important for a school in which you have faculty scholars available to them, these students, the PhD students, to serve as research assistants, graduate assistants, teaching assistants. It enriches the culture of our school, in my opinion, and so I'm very excited about that. We're considering undergraduate degrees in nutrition science and medical laboratory science. Those are two areas in which the workforce needs are undeniable based on what the Bureau of Labor Statistics says about growing areas of our labor market, those are two that would fit in the School of Health Sciences that makes sense. We need to really study the viability of those programs. Mm-hmm. We're in the infancy stages of really exploring those as possibilities. I also want us to continue growing our online options. So we're thinking about an online program for our health informatics graduate degree. There are a lot of exciting things happening in the school as it relates to academic programming in particular.
Mm-hmm. And you mentioned the PhD program, the undergraduate program, online program. Also, we may be working with high school students, right?
Yes, thanks for noting that. Mm-hmm. We were awarded a grant by the New York City Public Schools Bloomberg Foundation and Northwell Health for a high school that those three entities are opening in Queens. And so they put out a request for proposals from universities to develop early career pathway programs and college credit programming. I'm glad to announce that we were one of the universities chosen.
Great.
The school opens in August of this year, so the fall. It makes a lot of sense because of the School of Health Sciences has many of the disciplines that this high school will be providing training in for the students. And the one in which we were asked to develop the college credit programs and the career pathway programming for is in the area of behavioral health. Mm-hmm. And so, we have graduate programs in mental health counseling, marriage and family therapy, creative arts therapy, rehabilitation counseling. And so we're a perfect partner. My colleagues and I are excited about this opportunity.
Amazing. And as someone who's from Queens, I'm really thankful that this is, happening in Queens. It's so needed. So that's just amazing that we're getting to work in that area. Any final thoughts or reflections you'd like to share with our listeners as we close out this academic year and we look ahead to the next year?
First, I want to thank you for stepping into the role as the host of this podcast. When I first approached you about it, I didn't know whether you would accept the challenge, but you did, and it's been clear that you were the right choice.
Oh, thank you.
So the other compliment I hear about the podcast is generally around you.
Oh.
That's a genuine statement about you as the host. And so I'm extremely appreciative to you for what you've done with the guests that you've interviewed, the way that you have promoted the podcast. As I said, we chose the right person to serve as host. And I also want to thank the guests, as I just mentioned, who agreed to come on the podcast, because it's important to have individuals who care enough to come and share their knowledge, their experiences, their perspectives, their ideas, as it relates to healthcare in this country. And so I'm very thankful to all of them. And I'm thankful to the listeners, mm-hmm. people who tune in. And so I'm hopeful that next year we can continue with you at the reins so that we can invite even more impressive guests for you to interview.
I want to say thank you for thinking of me to be the host for the podcast and for entrusting me with this, your brainchild, your baby, and giving me free rein to curate guests to come in to share their expertise with the audience. Appreciate that. Thank you.
And before we close, I also want to thank John Mullen.
Yes, definitely.
Who was there with us at the beginning.
Yes.
His coaching was invaluable.
Very much so.
Guidance and advice as to how we should design the podcast. Mm-hmm. To him and the Herbert School of Communication.
Yes.
I also would like to extend thanks.
Yes, exactly. Because we could not do this podcast without them
not.
At all.
We could not.
So their partnership was just invaluable, as you mentioned. And John has just been incredible to work with.
Yes.
So a special thank you to John. So any last words you'd like to share before we wrap up today? Or?
Well, I'm looking forward to a second year.
Well, thank you so much, Dean Reggie, for just your vision, once again, for the School of Health Sciences and for your thought leadership. So on behalf of all the faculty, we really appreciate you and all that you do for us and for our students and for the community. So just thank you for all that you do.
Sure, thank you.
Great. So this wraps up another episode of The Healthline, Issues That Shape Our Well-Being. I would like to thank our studio engineer, John Mullen. I would also like to thank WRHU Radio Hofstra for their help with the production of this podcast. Lastly, I would also like to thank Hofstra School of Health Sciences for sponsoring this podcast. I am Dr. Andrea Ault-Brutus, and thank you for listening. Have a great day.